Hi everyone. We've been over the normal anatomy of the neck and what the MRI looks like. Some of you, probably many of you who have had an MRI of your neck have had it because there's a disc herniation, or they call in the report there was a disc herniation or disc bulge of some sort in the neck. So I wanted to show you what that means in general terms and what it may translate into. Um, we will discuss about just anatomy, but we can later discuss probably different treatments that are available. I'll probably point at some of them as we go along. So basically, I start again by going over the normal. If you catch that video, it's the normal anatomy of the neck, which is bone discs with the line in the back that is nice and straight. There's no bulge. The discs are high. In terms of their height, they're nicely hydrated and contained within their compartment and boundaries. The spinal cord is back here with the fluid around it that looks white on this image. And again, we're looking at it, somebody from the side, looking basically cut in half and then looking from the side. The neck is here, the back of the head is here, and these are the bones in the back and the throat. So watch that video, normal anatomy of the neck, if that's an issue. But for comparison, I put this up here. So now, if you look at a herniated disc, in this case, you will see, again, we're looking at the brain here. Now you can see the head a little bit better, so you can really appreciate where the neck is, where the brain ends. This is the brain. And then, again, this is the spinal cord. Now, in this case, you will see that the bone disc, they're not as nice and tall and white like this one. You see, remember, this is more normal. There's the black line in the back and the front, and then the disc is well hydrated and tall. These are all dark. They're collapsed. The bones are coming closer to each other. And the fluid around the spinal cord is there. But in some areas, there's a little bit of compromise of that fluid. And in this one, you see there's a piece of this disc that is bulging out and is actually pushing into the spinal cord. Now, in this view, it's kind of hard to appreciate where exactly that disc is and how bad this is. And obviously, it takes a trained eye and examination of you and your doctor to explain to you what it means. But basically, it means that the disc has failed to function normally, and it's pushing that boundary, or even sometimes a piece of it kind of breaks through and goes into the canal where there's really confined space and surrounded with bone, so the spinal cord in the middle doesn't have anywhere to go, so it gets compressed. And that's what this is. There's bone in the back and bone around it, and this piece of disc or whatever that may push into that canal, that space, just squeezes the spinal cord. Now, if we cut this through here, kind of like that, like this, and look from below, then you will see the familiar picture again. From normal, again, you will see that the spinal cord is in the middle, surrounded by bone. Around it, the big bone or disc in the front, and the nerves that are coming out here are nice and plumb, and there's a wide canal, wide area where they're going out to the arms. In contrast, if you look at this is abnormal now, and you will see that the bone back here is still there because it's bone, doesn't move usually. And you will see that this area where the disc is, or the bone is not nice and smooth anymore. And there's a little bulge that comes in, and the spinal cord has moved back from its original position where it's supposed to be nice and round, kind of sitting in the middle. It's pushed back and a little compressed. And remember those areas where the nerve is coming out here is nice and open. Look at this one. This one, the area is closed off basically by a piece of disc that is pushing onto that nerve. So the disc may hurt if the disc is incompetent and there's probably some movement there. It may hurt. Even if it doesn't hurt, it's pushing on the spinal cord, so it can damage the spinal cord. And also, by the virtue of the fact that there is the piece of disc pushing on the nerve, that nerve is going to the arm, and so you may feel some pain shooting to arms, shoulders, or behind the shoulders, depending on which level of the neck we're talking about, the nerves may go to different areas. So basically the treatment for this basically would be a decompression. Sometimes you can get by without surgery. A lot of times you can get by without surgery if the spinal cord is not compromised. The pain can be managed with medication, with injections, depending on what it is. If there's no weakness, if everything else is working okay, depends how fast it happens. So there are a lot of things that go into it in terms of decision making. But just because you have a disc herniation in the neck doesn't mean that you have to have an operation or something drastic. Generally, basically, either the nerve can sometimes be decompressed from the back just with a small little tiny incision without really fusing anything. Just a little rotor would do around the nerve. And sometimes we can even take out a piece of disc from back there. Alternatively, some people would recommend going from the front and coming this way and taking out this whole disc and putting a block of wood or a disc replacement or something in between. Sometimes if you put a block of wood, block of bone in there, it's like having a spacer, like a piece of wood you put between two different pieces of wood to keep it separate. If you put a block of bone in there, usually cadaver bone or some kind of synthetic cage there, it will stay there until these bones fuse together. And going through this way, you can obviously decompress the spinal cord from the front, take all that disc out. So it's a good way to do it. However, again, a lot of times, a lot of these things are seen, and we go through without surgery. We can get a lot of patients through without surgery, or if we have to do surgery, we can do something really, really small. Sometimes we don't even need to fuse it. As the technology is coming along, we can have options like disc replacement or a variety of different options that you may have. But that changes, of course, based on the examination, the story, and what really the MRI looks like. So all I'm saying, there's tons of options. Here's a cartoon. Well, actually, this is the spinal cord in probably the wrong level, but it gives the idea. It helps me explain to you the idea. This is exactly what we were talking about: the bones surrounding the spinal cord, and then the nerves coming out from the spinal cord going to the arms. So I hope this was helpful for you. If you have any general questions, feel free to write to me. Again, you have to talk to your doctor about specifics, but at least now you understand what the discs are. Sometimes these discs are in one level, or sometimes more than one level. Sometimes they're hard, they're bony, and it's harder to take out. Sometimes they're soft, and especially if it pops out all of a sudden, there's more of a chance that the spinal cord can't tolerate that loss of space and pressure on it. So people have more symptoms. A variety of symptoms can happen, weakness, numbness, stiffness, bowel or bladder incontinence, or even inability to void is possible. So this is an important part of the body, because damage to the spinal cord specifically is well, basically you can't repair it. Spinal cord injury is a serious thing, and so do talk to your doctor about it and make sure that you understand everything, and good luck to you. If you have any questions, happy to answer. I hope you enjoyed the video. Thanks.